Share my screen. I want to know if you can see my cursor too, so hold on. If you can't, it's not going to work. So, all right. So, a couple questions. Can you see the skeleton? Can you see my cursor moving around the screen? Oh, good. Oh, good. Let me ask you one more question. Hold on. Can you see the new skeleton? Okay, different color. Okay. Oh, boy. All right. It's a happy day for me. Yes. Okay. Miss Petrie, just because you're being so affirming and smiling, what bone is this right here?
Okay, sorry, my microphone wasn't wanting to come on.
Yeah.
Femur?
Femur. Very, very good. Thank you very much. Thank you very much. Miss Cooper, what bone is this right here?
Your femur?
Can you see what I'm pointing at?
Yeah. Is that... Sorry, I don't have my glasses on.
Well, go get them.
I should.
Yeah, you go get your glasses. I'll come back to you. Miss Nguyen, what bone is this right here?
That, and the forearm, sorry, you can come back me.
How about I tell you, and then I'll ask you 7 more times.
Okay.
Because that's what I do. Let's ask Miss Cooper. Miss Cooper, what bone is this here?
I don't know.
Well, it's in the brachial region. It's very funny.
Can I say funny bone?
You could say funny bone. It's not quite.
I want the actual term.
The hummer.
It is the hummer, so to speak, but let's go. It's the humerus. Remember the good old humerus? Cool. All right. Don't worry. I'll come back and ask you that question again. Miss Felix Osuna, what bone is this?
That's the femur.
Yeah, what bone is this?
Humerus.
Thank you very much. Miss Monreal, what bone is this?
Femur.
Yeah, what bone is this?
Humerus.
What bone is this?
Hold on. Move the arrow again? If I can. Clavicle?
Well, no, that would be in front. This is in back. It's a little triangular bone here.
Oh, okay. Scapula.
Thank you, ma'am. Good
My
job.
screen is so little.
I know.
Anyway. Okay.
This is hardly perfect, but we're just, doing a little quick review to make sure people know major bones.
I guess now that you said that, yeah, it's the back of the person.
Yeah, you can't see her face, but I should have told you that. It's all good.
Okay.
It's good. You guys, when you mess up, you help each other because everybody messes up and they feel self-conscious about it. So it's fine. And you give me something to giggle about. So that's good too. Miss Stanley, I know you're not feeling well, but I know you know your anatomy. So what bone is this?
Femur.
Yeah. What bone is this?
Humerus.
Yep. What bone is this?
Scapula.
Cool. What bones are these?
The spinous process.
They are actually the spinous process of your vertebrae. Wow, that was really precise. Okay, we'll take that. Thank you. It was more than I was looking for. It wasn't wrong. Miss Balatic. Miss Balatic, what bone is this?
The femur.
Yeah. What bone is this?
The humerus.
Yeah. What bone is this?
The femur.
Yeah. What bone is this?
The scapula.
What bones are these?
The spine.
It is the spine. The spine is made up of 24 little bones. What do we call them?
The spinous process.
The spinous processes are on those 24 little bones. And you're right, they're right there. I mean, these are good answers, but what do we call those little bones? Do you remember? It starts with a V?
V.
A V, yeah. You got 24.
Vertebrae.
Yeah, thank you. And they do have spinous processes on them. Thank you very much. Good point. Miss Torres.
Yes.
Let's see if I can, there. Did that make it bigger for you guys at all?
Yeah, that's much better.
Okay.
Yeah.
All right.
For me, yeah.
Well, let's see what I can do here. Hold on. But I don't want to lose the head. All right. Let's go there. Okay. Miss Torres, what bone is this?
The femur.
Yeah. Do you know what bone this one is? This big, thick one down here? We haven't.
Is it the tibia?
It is the tibia. Thank you very much.
No, that's the one in front, right?
Well, it's not in front. It's to the medial side.
Okay.
You got two bones in your leg, and one is on the medial side down here, and it's the tibia. You were right. The bigger, thicker one is the tibia. The one on the outside is the fibula. But anyway, tibia, because I'm going to ask other people that question, so I'm repeating it.
Fibula.
So, yeah, but tibia over here. Tibia, good. Femur, what bone is this? Torres?
Humerus.
Yeah. What bone is this?
You can't hear me?
I heard you say humor, but go ahead, say it again.
Scapula.
Got it. Yeah, you cut out first time, but I got you that time. What bones are these? There's 24 of them.
Scapula.
I got scapula.
The vertebrates.
Yes, the vertebra. Thank you. Awesome.
Vertebrates.
Vertebrates? I thought they were vertebrae or vertebra. But either way, you're right.
Vertebra. Yeah.
Cool.
Whatever you think is better.
Thank you, Ms. Torres. All right. Thank you. Miss Hanson. Miss Hanson, what bone is this?
The femur.
Yeah, did you hear what bone this was?
The tibia.
Yeah, tibia. Very good. Tibia. Very good. We haven't learned that yet. We're just trying to add information to your guys' repertoire. What bones are these?
Vertebrae.
Yeah, vertebrae.
Yeah.
Vertebra.
I don't know how you want to say.
I think it's one vertebra and multiple vertebrae, but that's fine.
Okay.
What are the pointy things coming straight out the back of the vertebrae?
Those the spinous process.
Yeah. What are these pointy things coming off to the side of the vertebrae?
I can't think of the name of them.
Well, they're kind of going flat through the transverse plane. So these are called spinous processes, the ones in the middle. And these ones out to the side are going through the transverse plane. Are they processes still?
I think so.
They are. So you got spinous processes and something processes that go through the transverse plane. What do you think you might call those other processes that go through the transverse plane?
Are they
Transverse processes? Yeah. You're overthinking it.
I might need help on that one.
I love it. All right, so spinous processes and transverse processes. Good job. Yep, I'll come back and ask you more. Take a break. Miss Yanez. Miss Yanez, what bone's this?
The femur.
Yes. What bone is this?
The tibia.
Yes. What bones are these?
Vertebrae.
Yeah, what bone is this down here?
Is that your sacrum?
It is your sacrum. What's this little bone right off your sacrum?
The coccyx?
Coccyx, well said too. Coccyx, cool. What are these processes coming off the sides of the vertebrae?
The transverse processes?
Good. What's this bone up here?
The scapula?
Yeah. Can you see this little ridge on the scapula here?
Yeah.
What's it called?
Is it the spine of the scapula?
It is the spine of the scapula. Yep. Very good. What's this bone here called?
The humerus?
Yep. I think that's enough. Thank you, Ms. Janitz. Good job. Miss Petrie. Miss Petrie?
Yes,
What's
I'm here.
oh cool. What's this bone?
The femur?
Yep. What's this bone over here?
Is it tibia or tibula?
Oh, jeez, no, tibia.
Tibia. Okay.
Because this one on this side is called fibula.
Okay. Is
Tibia.
that the thing that is for the other part of your arm? Why can't I think of the name of this part of my arm right here?
Your forearm?
Yes.
Oh,
Is that the same? Is that tibula and fibula as well?
no, but you are right that your lower leg and your forearm have a lot of similarities to it. They both have two bones in it. Your legs and arms are actually very similar in some ways.
Okay, but they don't have the same name.
No,
Okay.
up here, this bone in back is called your ulna. The one
Oh,
going
and the radius.
ulna and radius. Yeah, once I said it, you knew.
Okay.
You just need to kickstart the engine. Cool.
Okay. So we got the tibia, the fibula, the ulna, the radius.
Yeah, tibia, the big one
Okay.
on the medial side. Fibula, small one on the lateral side. Ulna goes to your elbow. Radius goes to your thumb. We'll explain that more later.
Okay.
Good. What are all these bones called?
The vertebrae.
Yeah. What's the last vertebrae called? Right down here.
It's called the floating rib.
No, that's floating rib up
sorry.
there.
That would be the
I'm looking for a letter and a number.
yeah. Is that L12?
L12. This is a very interesting person you have built. So this person has 12 lumbar vertebrae and 12 thoracic vertebrae and 7 cervical vertebrae. They have 33 vertebrae. They have 7 more than Let's count together. There's 1, 2, 3, 4, 5. Actually, this person seems to have 6 lumbar, but they're supposed to have 5. So,
Okay.
so the last one would be, if they're supposed to have 5 lumbar, the last one is what?
It'd be L5. I'm sorry.
Yes, don't be sorry at all. I'm sorry for laughing. It was just cute.
No, it's fine. I don't know what I was thinking.
I know what you were thinking.
I guess I was thinking that because there's 24 and there's 12 on each, it's supposed to be like 12 on each side.
Yeah. Also,
Okay,
also
so-
this is T12 up here, thoracic 12.
Right.
Yeah. All right, good. Thank you, ma'am. That's it.
Is the
Oh.
floating rib on T12?
Yes. The floating ribs, right? You have 2 of them, so they're on
Yeah,
T.
the floating ribs.
So they're on T11 and T12.
Okay. Thoracic, T11, T12.
Yeah.
Okay.
That's a good question, actually, to
Just
ask.
checking.
Yeah.
Just checking.
It's important. Yeah, I love it. Okay. Mr. Kandaris.
Yes.
Sir, what bone is this?
Femur.
Yeah, what bone is this?
The tibia.
What bone is this little skinny guy on the outside?
The fibula.
Beautiful job, sir. What bone is this?
The scapula.
Yeah, what's this ridge on the scapula called?
The spine of the scapula.
Yeah, what's this bone here?
The humerus.
Very good. What are these processes out to the side of the vertebrae called?
Transverse processes.
Yeah, I love it. Sir, these hips are formed with 3 different bones. There's one on top here, there's one kind of in front here, and there's one in back.
The ischium, and the pubis.
Woo! All right, Mr. Kandaris. I'll come back to you later with harder questions. Miss Hunter. Miss Hunter, you are driving right now, so you probably can't look at the picture right now, and I'm not sure I want you to. Wait, are you driving?
No, I parked for 5 seconds.
Is this going to make you late?
No, I'll be fine.
Okay, because I can ask you to like name muscles instead if you want, where you don't have to look.
I want to see the picture. I like the picture.
Okay, all right. Well, then you look at the picture. Okay, so what bone is this, Miss Hunter?
That's the femur?
Yeah, it is. What's this thick bone to the medial side right here called down here?
Tibia?
Tibia. Yep.
Oh, tibia.
What's the little thin bone to the outside called?
That tibia or fibula?
Fibula.
Okay.
Fibula. Yeah, cool. All right. What is this bone down here at the base of the spine called?
That sacrum?
Yeah. What's this little bone off it here called?
It's the tailbone, but it's coccyx?
Coccyx, yeah. What is this part of the hip called?
Oh, the iliac crest?
Yes, well, this is the iliac crest. This is the ilium. The whole thing is the ilium. That's good. We're good. What is this bone in back that you sit on called, right back here?
Is it the sciatica? No?
Well, your sciatic nerve goes through there. You're absolutely right. But this is another hip bone. What's it called?
That, I want to say, no, that can't be the pubic one because it's
Nope.
too far away.
Pubic's up front here.
Right. Ischium?
Yeah! Ischium. Good. So we got ilium, ischium, and pubis. Just since you're taking a quick break, let's ask you a few more things. What bone is this?
That's the humerus.
Humerus. And what bone is this?
The scapula.
Yep. What's this ridge along the scapula called?
Spine of the scapula.
Yeah. What's this edge of the scapula called?
The medial something.
Medial border of the scapula. Very good.
Medial border, yeah.
What's this edge of the scapula called?
Lateral border.
Yes. What is this tiny thing coming off the spine of the scapula up here called? Right out here in your shoulder pad. It's part of the scapula.
I know. I always forget the smaller ones. Is that coracoid or something?
No, chromium process.
Oh, chromium. I knew it was something weird.
Coracoid sticks out in front. We'll get there. We'll get there. What are all these bones here called?
Vertebrae?
Yeah. What is this? What's this last vertebrae called? Letter and number.
L5?
Good. L5. Then what's this one? The first vertebrae after the thoracic region. What's this one called?
L1?
Yes. What's the one right above L1 called?
T12.
Yes. Awesome. What is the topmost vertebrae called? Sorry, C1?
Yeah, C1.
Yeah, C1 is 100% correct. Give me another name for it.
Oh, crap. Oh, no. I know there's another word. Oh, my God. Is it... Oh, my God. Is it cervical something?
No, it's a Greek god that holds the world up.
Atlas.
Atlas, yeah. And what's the next vertebrae down called?
Is that the one that's like cervical or whatever?
Well, it is C2, but what's another name for C2? It's the one that C1 rotates around.
Is it like an axis type thing?
It's exactly like an axis type thing. Just say axis.
Oh, axis. Oh, okay. I didn't know it was that easy. I just know rotate is axis. Okay.
That's what the clue was meant to take you there. That's good. So we're on the same page. Last thing, let's go over hip bones one more time here. What hip bone is this? The what?
You said ilium, right?
Yep.
Okay.
And then what's this one? In back?
Ischium.
And what's this one in front?
Pubic.
Thank you. Thank you, ma'am.
Yay!
Yay, good job. We'll talk to you in a little bit. Let us know when you get to the next rest stop.
All right. Sure.
Miss Harper.
Yes, sir.
Hi, Miss Harper. Miss Harper, let's...
Oh my goodness.
You stressed?
No,
Oh.
I'm good.
Oh, all right. I believe you. Hold on. You just said, oh my goodness, that's all. I want to adjust this really fast. I feel like you want a challenge.
No.
So we're going to switch the skeleton up on you. Because I love your reactions. We have now flipped the skeleton. We are in front.
Oh my goodness.
Please name the 14 bones of the face. No, I'm kidding. I don't know the bones of the face. Don't worry about it. I'm teasing. We haven't learned these yet. What is this bone here? It's going from the sternum over to the acromion process right here.
It's not the spine.
No, this is a bone going from the sternum to the acromion process.
Is that a joint?
Well, there is a joint. There's a sternoclavicular joint and the acromioclavicular joint, but what's this bone called?
What's this bone called? Wait.
You almost said it.
Clavicle.
It is the clavicle. Yes. Thank you. What's this bone here called?
That's the humerus.
It is the humerus. What's this part of the hip called?
That's the ischium.
No, that's down here.
Oh, that's the ilium.
Ilium, yep. Down here is the ischium. What's this bone up front here called?
That's the pubic.
Pubic, or pubis. Yeah.
Pubis.
I love that. Hey, what's this bone here called? This kind of triangular upside down bone here.
That's the sacrum.
That is the sacrum. What's this joint between the sacrum and the ilium called?
That's the sacral.
Yes, keep going.
Sacral iliac joint.
Yeah, it is. Sacroiliac joint.
Iliac.
Yes. Yeah, these are hard questions, by the way. I think you're actually very good at anatomy. That's why I gave you hard ones. I took it easy on everybody else, Miss Harper.
No way.
What is this bone?
That's the femur.
It is the femur. What's this thick bone on the inside of the leg called down here? We haven't talked about it a lot, but...
That's the tibia, right?
It is the tibia. You can't really see it in this picture, but there's a thin bone on the outside here. What's it called?
That's the fibula.
That is correct. All right. Let's do one last thing. What's this bone right here called?
That's the sternum.
It is. Thank you very much. Thank you. All right, Miss Cooper. Miss Cooper. Are you there?
Yeah, I'm here.
Cool. All right, Miss Cooper. What bone is this?
That is the femur.
Yep, what bone is this?
The tibia.
Yep, what's the little thin guy out here?
The fibula.
Beautiful job. What bone is this down here?
The sacrum.
Yeah, what's the little bone coming off the sacrum?
The coccyx.
Very good, coccyx. Yeah, very good. What is this part of the hip called?
I don't remember.
Well, it's either pubis, ischium, or ilium.
Ilium.
You are right. It is the ilium. What's this part in the back called?
The ischium.
Yes, I think Miss Petrie put something in the chat box about like ischium is in your tuschium or something like that. That's helpful. Good. And what's this one up here? What's the bone up in front called?
That one's the pubis.
Yeah. Good job. What's this bone?
The humerus, because it's funny.
It is funny. It's hilarious. What's this bone running across here, connects the entire shoulder girdle complex onto your body? This one bone.
What, the spina scapula?
That's in back. Does kind of run like that. This bone connects your sternum to your acromion process.
What, the sternoclavicular?
Well, that is the sternoclavicular joint right there, yes. So what's this bone?
Your sternum?
This is your sternum. What is this bone here coming off your sternum?
I don't know.
You know the name of the joint. You must know the name of the bone. Why is this called the sternoclavicular? Yes. That's awesome. Good job. I think that's it for now. Thank you, ma'am. Thank you. Miss Nguyen?
Yeah.
Miss Nguyen, what bone is this right here?
Sacrum.
Not sacrum, that's here. What's this bone?
No.
This part of your hip.
Fibers. No, fiber, right?
You've got 3 bones that make up your hip, your ilium, ischium, and pubis. Which of those 3 is this one?
Ischium.
No. Ischium's down here. You sit on your ischium, it's in your tuschium. Ischium's down here. What's this one up here? Maybe it might be the ilium. Do you think it's the ilium?
Ilium.
It is the ilium. And what's this one down here? You said
Ischium.
yes. And what's this one up in front called?
Fever.
Pubis.
Yeah, fever.
So what's this one up here called? It's
I forget
it's okay, hon.
it.
Ilium.
Ilium.
Yep. What's this one in back called?
Fibers.
How about ischium?
Ischium.
And what's this one up in front called?
Then I know. Fibers.
Pubis.
Fever.
Yeah. So what's this one up here called?
Ilium.
Yeah. What's this one up here called?
Ilium too.
Yes. Good. What's this one in back called?
Ilium.
Maybe ischium.
No, Ischium.
And what's this one in back called?
Ischium.
Yep. And what's this one in front called?
Fibers.
Pubis.
Fibers.
Good. And what's this one in front called?
Stupid.
Pubis.
Yeah.
All right. What's this bone up here called?
Lithium.
Ilium.
Ilium.
Good. What's this one up here called?
Lithium.
Ilium.
Ilium, right?
Yes. Ilium. Very good. What's the one in back here called?
Ischium.
Ischium. What's this one in back called?
Ischium.
Good. What's these 2 in front called?
Fire.
Pubis.
Pubic.
Good. I'm going to let you go. You did great. Thank you. I'm serious. Miss Felix Osuna.
Yes.
All right, Miss Felix Osuna, are you feeling smart?
Yeah.
All right. That's what I want to hear. Good. So what's this bone?
Oxygen.
What's this thick bone down here called?
Tibia.
And what's this one out here called?
Fibula.
Beautiful. What's this top of the hip called?
Ilium.
Yep. What's the back of the hip called here you sit on?
Ischium.
Ischium. Yep. What's this front part of the hip right here kind of called?
Pubis.
Pubis. Beautiful. What's this triangular bone called?
That's the sacrum.
Yeah. What's the joint between the sacrum and the hips called?
Is it the sacral?
Yes, the sacroiliac joint. Beautiful. What is this bone here called right in the middle of your chest?
Sternum.
Sternum is 100% correct. Now this gets a little trickier. Do you know what the top of the sternum right here is called? Do you remember? It has a name for it. But oh man, is it hard.
Does it start with the T?
Starts with an M.
I don't know.
Manubrium. Yeah. Do you remember what this? These are hard questions, by the way. Do you remember what this little part at the bottom of the sternum is called?
Right?
Yeah. What'd you just say? I think you said it 100% right.
Xiphoid?
Xiphoid process. So manubrium and xiphoid process are all part of the sternum, but they're the top and the bottom of it. Really good. Thank you, ma'am. That was good. Xiphoid process. Miss Monreal, are you there?
I am.
Oh, that's lovely. Miss Monreal, how are you with your bones?
I guess we'll find out.
Okay. Well, what bone is this?
Humerus.
Do you know your forearm bones yet? You may not. We haven't gone over them.
The radius and the ulna.
Yeah. So the ulna always goes to your pinky and the radius always goes to your thumb. They can switch positions. That's why I said that, because you can rotate your arm. So anyway, good. Ulna and radius and humerus. Beautiful. What's this bone up here that connects the sternum to the scapula, really, to the acromion process of the scapula?
Clavicle.
Yes, it is. What's this bone here called?
Sorry. We were just talking.
I don't want to have to get stern with you. I want you to answer this question.
Yeah, sternum.
Oh, good. Wow. And can you tell me what the top of the sternum is called?
Manubrium.
Yes. Can you tell me what this little bottom pointy thing's called?
Xiphoid process.
Beautiful job. Can you tell me what the joint is between the sternum and the clavicle called right here?
Sternoclavicular joint.
Beautiful. Can you tell me the joint between the clavicle and the acromion process?
Acromial clavicular joint.
Yes. Can you tell me the joint that is your actual ball and socket shoulder joint here called between the humerus and your scapula?
Is that the glenohumeral joint?
All day long it is. That was a really good job. Awesome. Thank you. Thank you. Really good job. Cool. All right, Miss Stanley.
I'm here.
Good. You still alive?
No.
No? Okay. Well, answer me this from beyond. What bone is this?
The sacrum.
The sacrum. What's the little tailbone coming off it?
Coccyx.
What is this bone up here called? This part of the hip?
Ilium.
Yep. What's the part in back here called?
Ischium.
Yep. What's the part in front here called?
Pubis.
Yep. What is the joint between the sacrum and the hips called right here?
Sacroiliac joint.
That is beautiful. What bone is this?
Femur.
Yep. What bone is this up here?
Sternum.
Yep. What bone is the top of the sternum called?
Manubrium.
Yes. What is the bone at the bottom?
Xiphoid process.
Beautiful. What's this bone called here?
Humerus.
Do you know what this, you are correct by the way, do you know what this bone running to the thumb is called?
That looks like the radius.
It is the radius. If it's going to the thumb, it's definitely the radius. What's this bone in back called that makes up your elbow and is going to the pinky?
Ulna.
Thank you. Good job. Go back to being dead.
Okay.
But not really. Miss Velotic. Miss Velotic. What is this part of the hip called?
The ilium.
You are exactly right, madam. What's this part in front called?
The ischium.
Nope, that's in back. Right back there.
Oh, sorry. The pubis.
Yeah. By your pubic region, right? And back ischium. Good. What's this bone?
The femur.
Yeah. Good job. Femur. What's this bone?
The humerus.
Yep. What is this little, what's your collarbone up here called?
The clavicle.
Cool. What bone is this?
Sacrum.
Not this.
Oh, I'm sorry. Sternum.
I knew you knew. It's easy to get them all confused, huh? Sternum. What's the top of the sternum called?
I know she just said it, but I don't remember.
It starts with man. Manubrium.
Manubrium?
Yeah, that's actually the right way to say it. Manubrium. Beautiful. Do you know what this one is down here? It comes off the little tippy part. It's a process.
The xiphoid process?
Xiphoid process. Yeah. Okay, last questions. What is this part of the hip called?
The ilium?
Yep. What's the part in back called?
The ischium?
Yes. What's the part in front here called?
And then the pubis?
Yeah, thank you very much, ma'am. Okay, Ms. Torres.
Yes.
Let's identify some stuff, Ms. Torres.
Oh god, he looks scary.
He does look scary. Yeah, that's what I look on Monday morning when I get out of bed.
Can you make it a little bit bigger?
I sure can. We definitely need to for this thing. I'll make it as big as I can, which is not that big, but let's do it. Yep. There we go. Okay. So this is just to kind of, yeah, we'll see here. What are these two big gray things here, Ms. Torres?
Lungs?
They are your lungs. What's this thing here, this red thing right here?
Heart?
It is your heart, madam. What is this ginormous organ right here?
Liver?
It is your liver. What do you suppose this sac is that comes before your small intestines?
Stomach?
It is. Very good. The other stuff here is really hard to see, but it's small and large intestines and such, right? Good job. All right, thank you, Ms. Torres. Miss Hanson?
Yay.
Did you say something else, Miss Torres? Oh, sure, good. Okay. Miss Hanson, what are these right here?
Those are your lungs.
Lungs. What's this thing right here?
Heart.
Good. What's this thing right here?
Liver.
Yeah, what's this thing right here?
Stomach.
Yeah, and what are all this stuff down here?
Intestines.
Intestines of some kind, yeah. Very good. What was that you said, Miss Hanson? You feel like you've been shortchanged? You wanted more questions? Okay, I'm sorry. I'm sorry, you're right.
Mr. Tapscott,
Yeah,
can you go back to the other one real quick?
sure,
With the intestines?
sure.
Sorry.
No, don't be sorry. This is what we're doing today. This is good. I mean, not all day, but all right. Yeah,
Okay, so the large intestines, right? Wait.
I think
Yeah,
this.
you know how you guys showed us in the abdominal massage?
Yeah.
Would it go under the stomach, or how would that be? And what is that right now that we're seeing?
I think we're seeing small intestines. So
Okay.
these pictures are what they call layered pictures, which they go down in layers, which is very helpful. But the problem is there's different stuff at different layers. And so I think they removed the large intestines when they pulled off that layer. And the small intestines
so
are kind of...
would that be like over? I
Yeah.
mean, I guess I'm just thinking of when
Well,
we do abdominal massage, you obviously don't have to push that deep to get to it then, correct?
No, they're actually pretty surface. Yeah,
Okay.
yeah.
That's all.
Yeah, yeah. Anyway, they are very surface. I was trying to think if anybody's ever had a colonic, like you can actually feel the stuff moving through your large intestine. It's very surface. Thank you for relating it back to massage, by the way, directly, Miss Monreal. And Miss Hanson, thank you for being patient, because I know you wanted more questions.
I don't know.
I was just trying to buy you some time, Carrie Ann.
Thank you. I appreciate it.
Okay, let's look around here and see what we can see. Again, this is in layers. There's some stuff missing, which makes it kind of confusing, all that kind of stuff. But, Miss Hanson, what do you suppose this muscle is running up and down here in the abdominal region? Good.
The name of it.
Good. And that goes all the way down to your pubic bone. If you can see, it kind of is attached by little tendons down here and goes all the way up and attached in these ribs. And you're right, it is an abdominal muscle. It's your six-pack abdominal muscle. And it starts with an R. And you've got a muscle in your thigh that kind of starts with the same word.
I don't remember.
I don't want you to wreck a perfect score by not giving me this answer here.
Rectus abdominals?
Yep, rectus abdominis.
Abdominus.
Yeah, good. What are these little muscles right here? They come off the coracoid process. They're going into ribs 3, 4, and 5 right here.
Is that your pectoralis?
It is your pectoralis.
Major, minor?
Both?
Or does it measure both?
One, both, two. Well, it goes into ribs 3, 4, and 5 and comes off your coracoid process, so it does not attach to your arm. So which pectoralis muscle is it? It's not both.
Minor.
Yes, it is the minor. Very good. Good job. And can you guys, by the way, see those veins coming out from underneath it? And nerves? That's where you and it goes up to your neck, actually, believe it or not. It comes underneath your collarbone, goes underneath this pec minor, and goes down your arm. That's your brachial plexus that can get trapped underneath the collarbone here and underneath the pectoralis minor. I have a bonus question for anybody, not for you, Miss Anson. You're fine. You did great. Thank you. I mean, it is for you if you want it, but my point is anybody can answer this. What is this tiny muscle underneath the clavicle here? Anybody know what this tiny muscle is underneath the clavicle? Right underneath the clavicle here, there's a tiny muscle that actually helps to depress the clavicle or elevate the ribs, depends on who you talk to, but it's a tiny muscle here. We did learn about it, but we haven't talked about it since. Anybody know what that muscle is underneath the clavicle?
Can I get 1/3 of a point for that I can't remember it?
Yes, you
I
can
do
get.
remember.
Oh, you mean
us talking about it.
so you want kind of like a.
Give me a hint. What does it start with? What
So
does
you
it
want
start
like wait a second though. For no answer, you want kind of like a sub point. Is that what you're saying?
Yeah, just be like, oh, at least you remembered it.
Okay, I'll give you a sub
No,
point. I'll give you a
what
sub
does it
point for
start
that. What?
What does it start with?
Well, I already gave you a clue, but you didn't catch it.
I know you said that it depresses.
Well, I gave you more clue than that.
Forget it. I don't know.
All right. Well, there goes your sub point.
He said sub. I don't know what.
Yes. Miss Felix Osuna is right. Subclavius.
Oh, okay.
Yeah, that was your clue, man.
Awesome.
Good job. Subclavius. It's a tiny muscle. And by the way, I pointed out here because it's in the picture and we can see it, but you can actually massage it. It's near the surface. When you're rubbing right underneath somebody's clavicle, yes, you are hitting their pectoralis major that we'll see later, but you are hitting their subclavius too.
Okay, so I have to ask something else, but then I want to go back to subclavius.
Okay.
What is the thing that is, I'm too distracted by this. What is hanging down at the crotch level? What
Oh,
is
down
that
there?
thing hanging?
There's so many good jokes I could make right now. I am guessing though that's the coccyx sticking out from behind.
Okay, that's kind of weird. I didn't think it
Or-
would stick out that far, but it looks
I wouldn't think so
gross.
either. Or maybe he's pooping a little bit. Like, I don't know.
That's what it looks like.
It's possible. It's anatomy.
Okay,
Yeah.
so back to
I mean, he does look a little bloated.
Yeah. Honestly, I mean, it could also be some more obvious things. I don't know if it's part of the muscle that attaches the penis to the body or something. I'm not that
I
knowledgeable.
mean, it does look like the shape of the coccyx.
Yeah,
but
that's why I'm.
why does that, like, is it really that far down? It doesn't seem like it would be.
No,
But
I think you're right. Now I want to retract that answer, but the problem is I don't have another good answer. I don't know what that is. I can actually.
They might have just made it to where you can see it for this diagram, from like this image. But I don't think it really goes down that far.
There is a way that I can find out here. Hold on 1 second, everybody. I'm cheating and looking at my computer program because it'll usually let me point to little stuff like that. Oh, that is, this makes more sense. That is the rectum. So that is the last part of your large intestine, right? That's your rectum. And so there's not enough flesh built up around there to finish off the bottom. That's your butthole.
Well, that's super interesting.
So when I said pooping, I was actually being childish, but I was probably fairly close to the answer. Because that is the end of your digestive tract. That is the tube sticking out. And once you have muscle around that and everything like that, you wouldn't be able to see it. But that's why it goes down so far.
Okay, so that's a subclavius.
Okay.
Is that right? Is that right?
Subclavius is correct, yes.
Okay, so with the thoracic outlet syndrome, you would try to, because that's like impinging those nerves, correct?
Yes.
So would you try to just get in there a little bit and like try to soothe it out?
I would. So
Okay.
the other thing that's kind of neat you can do is, I mean, you can rub underneath there, and you should, because you should be getting the pec minor for sure, but you should also rub right underneath there to get the subclavius for sure. And you could gently try to pull up the clavicle, right? Because you're trying to kind of just open stuff up in there. Just don't yank on it, but you can pull on it pretty hard as long as you go slow. And you're trying to open that area up, absolutely, because you're trying to make space underneath the clavicle. So I would most definitely do it.
Okay.
And it's good to know that, because people are going to be like, what are you doing? Oh, well, I'm loosening up your subclavius. It can pinch this muscle too, this nerve too. And then they're going to think you're all amazing because they won't even know what the subclavius is. Yeah. So you're absolutely right.
Okay.
I would loosen up neck muscles, subclavius, pec minor. Those would be some of my first go-tos for thoracic outlet syndrome. Cool.
Yes, thank you.
Thank you. All right. Miss Yanez. I think she's there. Miss Yanez, what's this muscle here called that runs up and down the abdominals?
Your rectus abdominis.
Yeah. What is this muscle over to the side? And I will make the comment that I would accept 3 answers because I'm not sure.
Could it be the internal obliques or the external?
Yeah, I mean, it could be internal obliques, external obliques. I can't see the fibers well enough. It could be your transverse abdominis.
Okay.
Like, it's hard. We could argue about it for a while, but I just wanted that thinking process going. Thank you. Hey, what are these muscles found like in between the ribs? Sorry.
I know it's costal something.
Yeah, right now, by the way, Miss Hunter is she's transporting herself between states. Yes, thank you. Intercostals, good job. Yeah, intercostals, and there's internal, external ones, but we don't care. They're all together. What's this muscle up here called that attaches to the coracoid process?
Your pectoralis minor.
Yeah, now this one's really tricky. I don't think this is a good picture of it or anything, but this muscle up here, this tiny muscle, it attaches to the coracoid process too, and it's going down to the midpoint of the brachial region here, midpoint of your humerus, but a brachial region is an important clue. It goes from the coracoid process to the brachial region. Do you know what that muscle's called?
Coracobrachialis.
You're 100% correct. That could be the long head of the short head of the bicep too. It's really hard to tell from there. Really hard to tell from there. But I don't think it is, because this muscle here is actually underneath the bicep. So what muscle is this? It's underneath the bicep. It only runs from here to here.
Is that the brachialis?
It is. And you've answered a lot of really hard questions. Thank you. That's enough. That was great. Okay. Miss Petrie.
Yes.
Miss Petrie. Well, really quickly before we go into another slide, what muscle is this here?
The rectus abdominis.
Yep. What muscle is this here?
That's the pectoralis minor.
Yep. And what's this little teeny muscle underneath the clavicle now called?
That is the subclavius.
Wow. I love that. All right. Let's go to another slide. I know you're bored with this one already. Hey, let's check this one out. All right. What's this? Well, what's this muscle up here?
That's the pecs.
Yes.
That'd be the pectoralis major then?
Major. It covers up the minor. You can't see the minor anymore. Yeah. Very, very good. What muscle is this, probably? On the outside here?
Is that the internal or external obliques?
Yeah, probably external or transverse. Yeah. Hard to tell again from this picture. Good. Let's see if we can see other stuff on here. Oh my gosh, we can. All right, this is hard to see, but there's some interesting stuff here. Do you know what this thigh muscle on the medial side of the thigh is called?
Vastus medialis.
You are 100% correct. Do you know what this thigh muscle is called that's on top of all the other thigh muscles and runs straight up and down right here? It's not in between these other two, it's on top of them. So it's not vastus intermedius.
Is it brevis?
Nope, you're thinking adductor muscles. Think of
I'm
your
sorry.
quads.
Or is that the gracilis?
You're thinking of adductor
Still
muscles.
On the wrong track.
Yeah.
Okay.
Think of your four. You already gave me vastus medialis. This one goes with that group.
Okay, so there's vastus medialis, vastus lateralis, vastus intermedius, and there is
That's the one this is. What is it? The one you're not naming.
I can't think of it. And I feel like I should have it, and I can't think of it.
You are wrecking a perfect score, just like Miss Hansen did with the abs.
Oh. It's the rectus femoris.
Yes, ma'am, it is. Rectus femoris. Good job.
Okay.
Hey, we have not learned about this muscle yet, but I think you know about it, Miss Petrie, because you and I have talked about it. It's kind of a shin muscle. It's found on the front of the tibia, and it kind of actually goes diagonal across the foot here. But do you know what this muscle is called?
Is that the one that starts with an S?
Well, it's on the front of the tibia. Some people say it's on the anterior side of the tibia. And that's the name, pretty much.
Right. So, interior fibula?
Or anterior tibialis, or tibialis anterior?
Yeah.
Yeah, we'll take that. Okay, that was enough brain stuff. Sorry. That was good. Good. Okay. Mr. Kandaris. Sir,
Yes, sir.
what muscle is this?
Pectoralis major.
Thank you, sir. What muscle is this?
Bicep.
Yeah, bicep. What? You have two biceps in your body, so
Yeah.
thank you very much. What? Do you remember what this aponeurosis is called? This sheet-like aponeurosis right here is called?
Abdomen.
It is. It's your abdominal aponeurosis. This big sheet-like tendon is called your abdominal aponeurosis.
Okay.
It's pretty close. Do you know what this quadriceps muscle is called?
Is that your vastus medialis? pectoralis.
Yes, because it's on the medial side. Good. Do you know what this long quadriceps muscle on top is called?
Is it also vastus?
No. Underneath there's another vastus, but this one's on top.
Okay. Is it Magnus?
Nope, that's an adductor muscle.
That's the adductor one. Yeah, okay.
It's okay to get them confused. I don't blame you guys at this point.
Not remembering it.
Well, I feel like you're going to wreck this just like Miss Petrie almost did.
Rectus quadratus.
What bone is underneath there?
Oh, rectus femoris.
Thank you, sir. Awesome. All right, anybody, can anybody tell me what this muscle is out here? On the side of your hip here? Anybody?
Is that like part of your glute overlapping or no?
Which glute?
Oh, max. Yes or no? No, wait. Because of your face now, you're like freaking out. I would have thought that it was max, but is it medius? Because your face didn't do anything. Come on, help me out, man. At least I got the glute.
Can you? I don't know if you guys can see me because I can't see myself right on this thing right now. Hold on. Give me 1 second here. Here.
I think it's gluteus maximus.
Let me show you guys a little trick. You should all do this with me. So, max, med, min. Gluteus maximus, medius minimus. Max, med, min. Now.
So it's minimus?
Yeah. Your minimus actually is essentially, don't get me wrong, your medius is heading that way too, but your minimus is most lateral, and it's what makes up your hips, really. Your hips really are kind of your gluteus minimus and medius too, but that's the minimus. So, way in back is your maximus. As you move towards the front, it's medius minimus. It's just a good way to remember them. There is some overlap in your glutes and all that kind of stuff, but the gluteus maximus doesn't get near the sides there, like that. Good, good.
Okay.
The fact you identified as a gluteal does give you a sub point.
Okay, that's what I was gonna ask for. I know I don't get money, but can I get just like a partial point?
Oh, you're getting money. I've just been investing it for you.
Oh, okay, thanks.
Yeah.
Do it through Jack. Don't do it through your imaginary service.
Yes. Yes. Okay.
I did make $100 in this class so far.
Yeah?
Yeah.
I love that. I love that.
Taking it home.
Yeah, no, good. All right. I love that you invest, sir. I think it's very, very wise of you. Miss Hunter.
So what muscle?
I'm so sorry, what?
What muscle was it? I get confused with. So what muscle was it? Because I get confused with the minimus and the medius.
Yeah, it was the
And I didn't
minimus.
see what you were doing.
It was, I'm sorry.
Oh, it was the minimus?
It's the minimus. Yeah.
Minimus? Okay.
The minimus is essentially your hips. So is medius too, but the minimus is most lateral and most anterior of the three gluteal muscles. They kind of work their way around.
So you do the So you do the abductions, right? With
Yeah.
those?
Yes, you do actually. And the gluteus minimus is so far forward they can even help you with a flexion of the hip.
Okay.
Yeah. Which is almost the exact opposite of what your gluteus maximus does. Miss Hunter, are you with us? Are you driving? Miss Hunter. Miss Hunter? Miss Hunter, please don't tell me I lost you because I have to. Alright.
She could be like going through mountains or something right now.
Yeah, but unfortunately, if she's not in class for too long, I have to mark her absent. We'll get back to you, Miss Hunter. Okay. Miss Harper.
Yes, sir.
Hi, Miss Harper. Hey, Miss Harper. These are some of the first muscles we learned about. So what's this big diamond-shaped muscle up here?
That's the trapezius.
You are right. What's this muscle here?
That's the deltoid.
You are right. What's this muscle back here?
That's the triceps.
It is the triceps, ma'am. Excellent. Good job.
Triceps back.
What's this muscle here?
That's the big one.
Yeah.
The latissimus dorsi.
Yeah. What is this muscle here?
That's the gluteus maximus, maybe.
It is. Not even maybe. What muscle group is this back here?
Hamstring.
Yes. What muscle group is this back here? The group. The whole group.
Yeah.
What do you call
The calves.
calves? Very good. Good job.
Calves.
Thank you, ma'am. Good job. Thank you. Miss Cooper. Miss Cooper, Cooper. Miss Cooper, what is this muscle here, this diamond-shaped muscle?
Sorry, you keep cutting out for some reason, but, the trapezius.
Thank you. What's this big muscle here called?
That's your, latissimus dorsi?
Yeah. Yeah, it is. Hey, what's this muscle right above the latissimus dorsi that I say latissimus dorsi, you say?
Infraspinatus? Right?
I say latissimus dorsi, you say what? You say Terry's what?
Terry's major.
Yes, good job. By the way, I'm not positive that's Terry's major there. It's hard for me to tell, but
Sorry, you can try my best.
you're doing fine. Okay. What's this muscle back here called?
The biceps?
Are the biceps in back of the arm?
Oh, that's your triceps.
Yes, ma'am, it is. What's this muscle up here called?
That would be your biceps,
Biceps from the back of the shoulder?
right? Oh no, that's the
Yeah. Glasses on.
that will be what is that?
Well, its origin is the insertion of the trapezius. It works with the trapezius to move the shoulder girdle complex. It comes down here into a point, like an upside down triangle.
I already said the trapezius. The trapezius is the big
Yep,
one.
trapezius.
That's
The trapezius inserts into this is the spine of the scapula, the acromion process, and the lateral one-third of the clavicle. Then the origin of this muscle is the spine of the scapula, the acromion process, and the lateral one-third of the clavicle. This muscle has 3 sections. They all insert into a tuberosity on your arm. And if I told you the name of the tuberosity, I'd end up telling you the name of the muscle.
yeah.
And if you don't get it right, I'm going to give you a D for today.
Deltoid?
Yes. Good job.
I'm thinking too hard.
That's okay. That's why we do this. All right, last question. This one's actually kind of tricky. What do you suppose this big white sheet-like tendon is called back here?
What?
It's in your,
Fascia?
it is fascia, and aponeurosis is fascia, but this is fascia found in the thoracic and lumbar region. And a lot of muscles weave into it. So we kind of call it your thoracic lumbar fascia, basically.
Okay.
So we call it your thoracolumbar aponeuroses. Thoracic with lumbar, thoracolumbar aponeuroses.
Alright. sounds like the name of a dinosaur.
It does. It does. Well said. All right. Thank you, ma'am.
Can you say that one more time, the sheet thing?
Yeah. It's, by the way, I'm making a big deal out of it because in front you've got that big white sheet and it's called your abdominal aponeuroses. And in back you've got this big white sheet called your thoro, standing for thoracic, thoro, with lumbar aponeuroses. It's the aponeuroses found in the thoracic and lumbar region, thoracolumbar aponeuroses. And to be honest with you, basically everything in your lower back just kind of feeds into it. It attaches down into your glutes. They make it look all separate here, but everything just kind of weaves into your thoracolumbar aponeuroses in back.
Would you type it in the chat?
Yes, I can.
Okay, thank you.
So I have a question.
Yeah.
Are you there, Mr. Tatscott? Okay. So, back to the glutes. So, does the gluteus maximus cover the minimus and medius?
Does the gluteus?
Okay, so
Say
are
it.
medius and minimus, are they deep to gluteus maximus? Or are they kind of next to each other?
So are you asking if the gluteus medius and minimus are deep to gluteus maximus?
Yes.
Yes. Let me just think for a second so I'm not telling you wrong. Oh gosh, I have to think about this for a second. Because they do run in a certain order. You're absolute. I really like this question. It's actually very important. Yes, they are deep and they go in order of like the medius is deeper than the gluteus maximus and the minimus is even deeper than the medius. So
Okay.
as they go lateral and forward, they go deeper.
Okay.
Gluteus max, med, min.
Okay.
Yeah.
And
And they overlap each other a little bit as they go forward. They kind of overlap going down. Yeah.
I do see the rectum now from the back.
Yeah, it's funny. I was going to mention it too. When I saw it from the back, I'm like, oh, well, that's the rectum.
Right.
But from the front, it looked weird. Yeah. I mean, it kind of looks weird this way too, but still. Okay. Good times. Okay. Miss Nguyen. Miss Nguyen, what's this big muscle down here called?
Dorsi.
Yes, latissimus dorsi.
Yeah.
Good. What's this diamond-shaped muscle here called?
Trapezius.
Yeah, trapezius. Good job. What's this muscle back here called?
And deltoid.
Yes, really good job. What's this muscle back here called?
Tricep.
Yes, fantastic. What's this big muscle here called?
I think medium, blue
Gluteus?
red in the maximum.
Gluteus maximus. Really good job. What muscle group is this back here? What? You don't have to name them all, but like, what is this called back here?
Okay.
Hamstrings, yeah. And what are these down here?
I think it's about trial that I don't understand that.
Calves. They're called calves, and there's 3 of them. In this picture, it's kind of, I think they're showing the uppermost one, but I don't love this picture.
I think,
But just calves. Calves is good.
yeah, trap.
Cool. Calves, we'll take it. You did great. Take a break. You deserve it. Yeah, I love it. Okay. Miss Felix Osuna. The person who knew what the subclavius was.
Yes.
Okay, we have ripped off another layer of muscle, so now this gets a little bit trickier. Okay? What are these muscles right here called?
Rhomboids?
They are the rhomboids. This is rhomboids, major down here and minor up there, but rhomboids. Thank you. What is this muscle right here called underneath the spine of the scapula?
Is it the
Infra what?
spinatus?
Yes. Anytime I say infraspinatus, you say,
Teres minor.
yeah. Good job. And if this is the teres minor, what's this one underneath it called?
Infraspinatus.
Well, no. Infraspinatus on top, then teres minor. What's this one down here called?
Teres major.
Yeah. Good job. What's this muscle back here again?
That's the tricep.
Yeah. What's this muscle here?
The gluteus maximus.
Yeah. What is this muscle group here called?
The hamstrings.
All right. This is tricky, and I have not done this yet. So if you don't get it right, do not feel bad. Do you know which... Well, can you tell me the three names of the three hamstrings?
Are they the vastus lateralis?
Biceps femoris.
Biceps femoris, submembranosus, and then semitendinosus.
Beautiful. Biceps femoris, semimembranosus, semitendinosus. Beautiful. Do you know which one of those is most medial?
Is it the semitendinosus?
Semimembranosus. And we remember that because membranosus starts with an M and medial starts with an M.
Yeah.
Membranosus. And I see people taking notes right now. You are very smart because you're right. I'll probably ask you these questions again. But membranosus is most medial, then tendinosus, and on the lateral side is biceps femoris. So, Ms. Felix Osuna, what's the most medial hamstring?
Semitendinosus.
Thank you. What's the one next to it?
Semitendinosus.
Yep, semitendinosus is still on the medial side, but it's not as medial. What's the one on the lateral side over here called?
That's the bicep.
Biceps femoris. Thank you. You did great. Thank you. That was awesome. Oh, let's see. Where was I? Oh my gosh. Okay. Miss Monreal.
Yes.
Miss Monreal. Miss
Yes, can you
Monreal.
hear me?
Yeah, I can hear you. What do you suppose this muscle is right here?
Rhomboids.
Yeah.
Major.
Rhomboids major and minor. They're both right up there. Hey, what do you suppose this muscle is running up the back of the neck right here? It's running like, it looks like it's going to make two speed bumps on the back of the neck here. Run straight up and down.
Hold on.
I'll let you know if you get it semi-right. Even if it's not perfect.
Semispinalis.
Semispinalis.
No?
No, it's just, I feel like there's something missing from that answer. Put on your thinking cap.
Capitis?
Semispinalis capitis, is that what you meant to say?
Sure, yes.
Good, semispinalis capitis, good.
So for real, it's semispinalis capitis? What is
Semispinalis.
splenius capitis then?
Splenius capitis and splenius cervicis and semispinalis capitis.
Oh, okay.
There's
So
three. There's three. And by the way, you might argue that this could be, I mean, it's hard to tell from this picture. This could be splenius capitis, but it's the angle's not right. This looks like semispinalis capitis. Yeah.
Semispinalis capitis, splenius capitis, and what was the cervicis?
Splenius cervicis.
Splenius cervicis. Okay,
Yeah.
yeah.
That one would be underneath here and it goes into the neck and we can't see it right now. What muscle is this back here on the back of the scap?
Infraspinatus,
Yeah, so what's this little one underneath it? Almost looks like the same muscle.
teres minor.
Yeah. What's this muscle below teres minor?
Teres major.
Yeah. What's this muscle back here?
Triceps brachii.
Yeah, I like that. What's this muscle here?
Hang on, because I gotta change my screen.
No problem.
Okay, so, which one?
Right here.
Gluteus maximus,
Cool. Hey, what muscle group is this here?
hamstring.
Yeah. What's the hamstring that's most lateral out here?
Of course you had to do that. Okay. Semitendinosus?
That's...
Wait,
Oh.
wait. I forget what the is. Okay, are you asking me of one of the...
Let me back you up on this question. Let me help you a little
Okay.
bit. What is most medial? Which one of the hamstrings is most medial?
Semimembranosus.
Yeah. Then next to it, it's still on the medial side, by the way, but next to it is the semi what?
Hold on.
There's only one other semi.
Yes, I know. What did I just say? Semimembranosus, and then so the other one is semitendinosus.
Awesome.
And then the third muscle is
Which is most lateral?
bicep femoris.
Yeah. Good job.
Oh gosh.
Cool.
Okay.
All right, everybody. We're just about done here. You guys are doing great. This was a lot. I just wanted to kind of make sure we didn't kind of, I don't know, forget stuff on the way, so to speak. And I want you guys to see anatomy from lots of different pictures, right? So you kind of get a feel for it.
Can we go back to the neck really fast?
Sure. So
You
this,
said there's 3 of them.
oh,
There's semispinalis,
okay.
capitis.
So hold on. I'll tell you them all, but I might even be able to pull up pictures specifically of the neck. So here's the deal, though. There's actually lots of neck muscles, really, even in back, because the 3 you're asking about are semispinalis capitis, right? Semispinalis capitis, which makes up the speed bumps of your neck. It's kind of what gives you the shape of these 2 lines running down your head. They're underneath the traps, but they push the traps up back there so that you have these 2 columns back there. That's semispinalis capitis. It runs down part of your spine, semispinalis, and it goes to your head, capitis, semispinalis capitis. Then we have a splenius cervicis and a splenius capitis. Both of these come off the spinous processes. Splenius capitis comes off the spinous processes and goes to your head. Splenius cervicis goes off the spinous processes and goes to your neck. Let me see if I can pull up a picture of that, because it'll be a lot better than you just trying to visualize it. Let's see here. Bear with me.
I'm sorry, did I miss something?
Probably.
Did we go over neck muscles yet?
Well, we did in back when we were doing the thoracic region, and we went up there.
Okay.
So, I mean, to answer that, yeah, we have.
Oh. Okay.
You and I have actually gone over them. It's just been a while.
I don't think we spent that much time on those, right?
Right, we didn't. We didn't.
Yeah, because they're still confusing to me a bit.
Okay, so I'm not the only one who feels like we haven't really gone over these yet.
You are not losing your mind, if that's what you mean.
Yeah, that's what I was wondering. I'm like, is there something I completely missed? Was I asleep and didn't know it?
Yeah, hold on. I'm going to try to get you guys a picture of neck muscles here. All right. This. Okay. I need to share a different screen with all of you, but I think it's important we do this, especially since people feel like what the heck's going on, right? So bear with me. Let's get this down here. Let's get this over here. So I'm going to share a different screen with you, and we're going to end with this too, so that you're not, I don't know, just because it's enough. But so let me switch my presentation here. All right, I'm going to switch screens here. And let's see if I can, aha, here we go. Okay. All right. Can we all see this picture of the back of a head? And somebody needs to say yes too, because I can't even see you guys right now.
Yes.
Okay, thank you so much.
Yes.
All right. So, here's the scoop. Do we see these diagonal muscles right here?
Yes.
That is splenius capitis. It's going from the spinous processes here up to the head. Splenius capitis. By the way, this is your ligamentum nuchae, that ligament that goes in the back of your head. But anyway, this diagonal muscle that you can kind of see highlighted here, is going from the spinous processes to the head, splenius capitis. If we go down a layer, we're going to get to the semispinalis capitis. So we're going to take that layer off there. Here is semispinalis capitis underneath there. You can tell this because the fibers run up and down. The other one, they kind of ran it at a diagonal. So if I go back up, these run at a diagonal. This is semispinalis capitis. It's going to the head, but it's coming from the spine. Semispinalis capitis. You go down a layer. I'm sorry, splenius capitis was the first one. Semispinalis capitis is below. I'll see if we can get splenius cervicis. That's semispinalis capitis. Bear with me. By the way, here are your suboccipitals underneath here that we learned about. But I don't think we're going to get a good picture of... This is not a good picture, but this is semispinalis cervicis. It's going from the spine into the neck. So it's super deep. So at the deepest layer, you've got the suboccipitals here. 4 of them on each side. You've got the semispinalis cervicis. It comes from the spine and goes back in the neck. If we go up a layer, we get to semispinalis capitis, straight up and down, goes into the cap from part of the spine. And if we go up another layer from that, we get to splenius capitis, coming from the spine, spinous processes to the head. Now, let me stop presenting for a second. Now, if that seemed confusing, it is because in your book you've been looking at pretty pictures of a single muscle at a time. The human body is actually very complicated and everything starts to weave and it gets very hard to tell stuff from one another. And to be honest with you, when you're working on somebody, I don't really care if you know if you're on the semispinalis capitis or the splenius capitis. I just want you to realize there's a whole bunch of neck muscles back there, so you realize there's all these layers back there that you're trying to get through. Because a lot of them do fairly similar things. Yeah? Okay. So hopefully you can all see a picture of the pelvis bones. Remember the pelvis bones? That's where we started with this whole nonsense. And I just want to make a couple comments about them for later. Later when we learn about muscles, we're going to find that the glutes essentially all attach to the ilium and the sacrum up here. We're going to find that the hamstrings attach back here to the ischium, and we're going to find that all the adductors attach to the inferior arm of the ischium and both arms of the pubis, kind of up here in front. And so that's why these hip things are so important, because we're going to find that the glutes hook on up top here to the ilium and the sacrum, the hamstrings hook on to the ischium way back here, and the adductors hook on to the pubis and the ischium, but up in front. And so that's why we actually care about the hip bones, because later we're going to learn about these big muscles that attach to them.
Mr. Tapscott?
Yeah.
So just looking at that picture right there, so the gluteus medius would fit in that little groove? Would that be?
The gluteus medius would be, well, the maximus would be over most of this. Yeah, this groove? Yeah, that's about right.
No, like the top picture, like the other one. Can you do your little arrow? So over here,
well, you wouldn't see it on this at all,
yeah,
because you can't see the back side of here. But if you mean it would be like, it'd be up in here. Yeah, gluteus medius would.
Okay, I'm just trying to picture that other thing, the other picture that you showed me where I had guessed that it was Maximus, and I'm just trying to make things make sense in my head.
No, I love what you're doing. They will also make a lot more sense when we actually do the actual muscles, which we're going to be doing really soon here. So,
Okay.
but that wasn't to shut you down. That I agree with you. I like what you're doing.
Can we go over the attachments really fast one more time?
Sure. No, we can go over them really slow, even, Miss Hanson.
Okay.
So this is a side view of the hip. Do you see the side view of the hip? And I hope you can see my cursor. Okay. This is a side view of the hip, and this is a side view of your sacrum and your coccyx. The gluteus maximus, medius, and minimus all attach along here. They make up your hips and your butt, so they all attach along here, and they're going to attach. They really are going to attach to the ilium and the sacrum. So the gluteals attach to the ilium and the sacrum. I'm oversimplifying here a little bit, but that's a good thing to kind of remember. The hamstrings are in back, and so they attach to your hip bone in back here, your ischium. In fact, you see how rough the ischium looks here? It looks all bumpy and stuff. It's bumpy like that so that the hamstrings, the tendons of the hamstrings can get a really good hold on it. Your hamstrings are actually some of the most important muscles in your body, and we'll talk about that later when we get to them. And then the rest of your adductors attach essentially to your pubis. There's one that actually attaches back here to the ischium too, but essentially up here to your pubis. So if I want to super oversimplify, but it wouldn't be terribly inaccurate, gluteals like to, oh geez, that's not helpful. Gluteals like to attach to your ilium, hamstrings to your ischium, adductors to your pubis. Does that help? Cool. And that's a really good way to think about it. And later when we learn the muscles, it'll make sense. That's all I wanted to share with all of you.